stay pretty active and fit, but I'm always looking for ways to help get my mobility a little bit better. And what I find is when I do, some therapy of some sort, add it to my workout, it always helps. So.
Okay, excellent. Should we start? So I'm Kathy Zackowski. I'm an occupational therapist and scientist, and Jen Keller and I have done a lot of research studies together for the last 20 some years. And we're gonna share with you today some information about rehabilitation for men with AMN. So Jen, you wanna introduce yourself too?
Sure. I mean, I started in this area with Kathy. She was the principal investigator in the lab working with Dr. Mosier on some of the first studies. And so that's how I got to learn from all of you about how to be the best PT I can be to help. I think I really appreciate your kind words, Tim. I think it's helped a lot over the years to be able to target the right things for people and to keep people motivated to keep exercising. I know I see that actually some of the participants are women, so we directed our talk today to men because you and I had been emailing, but the same principles apply to both groups. So just so that everybody's aware in that regard too. But thank you very much for having us tonight. We look forward to talking about it.
Yeah, you bet. And Patrick?
All right. Hi, my name is Patrick Broussard. I am an AMN patient. My diagnosis was in 2018, but I've been suffering from symptoms for over 10 years. And currently, I am the manager of a restaurant that I'm a partner on. And that's where I get the majority of my exercises by zooming around, running food to people, making drinks. Along with that, I also practice a steady regimen of Pilates. If you've watched Ben's video on ALD Connect, our exercise routines are very similar. I have a great Pilates instructor who is constantly pushing me to do more and more difficult exercises. And I would say that along with an active routine, Pilates is an excellent workout routine to supplement in your life.
Great. Well, thank you. And I guess Jen and Kathy, maybe we could turn it over to you. We have about 31 participants on right now. So whoever wants to take the ball, that'd be great.
I am trying to share my slides. Let's see if I can do that.
All right.
Hold on just one moment. Okay, see if that, let me know if you can see them now. Can you see the slides now?
Yep.
Okay, there we go. All right.
Although
so,
Kathy, it's not playing, it's just as the actual, like we're working on the slides. So I don't know if you want to, there you go.
is it, well, is it now?
Oh, no, not yet.
Now do you get it?
I mean, it's fine, but.
But it's, well, I guess for me, I'm seeing the slides. Are you seeing the slides now? No?
As though you're working on the slides, not like they're showing like a screenshot.
Just click slideshow and then.
Yeah, I am. That's,
okay.
no, I've been doing that. It's just not, and I hit slideshow. Yeah, let's try this. Right.
Oh, you know what? Somebody said that they're seeing it as a slideshow. So maybe maybe us as hosts, we see it in this
Oh, that's
way.
helpful. Thank you. I can't see the
Thank you.
Okay, I think I'll move forward because even if it's just the slides, there's nothing that you can't see anyway. So, okay, so Jen and I want to share some information, partly from studies we've done, but partly also from clinical experience, with the hopes that we'll give you some new information about movement and how to kind of direct some of your own rehabilitation in terms of exercise and activity. So now I can't move them forward. Okay, so the goal of the design of interventions or rehabilitation is really to address key impairments. And by key impairments, that includes things like biomechanics or your strength and flexibility, cardiovascular or endurance, and neurophysiology, including your balance. All of those things contribute to how well we can all move. But in terms of activity, what is important here, I feel like it's too distracting. Let me just stop one moment because I can't, I'm not looking at the screen because of the way it's being shared. So let's try this and see if that, now can you see the slides?
Yeah.
Oh, okay, so I'll keep going because again, it does the same thing. Is it moving forward now for you?
It's good. I think there might be a slight delay, so just go ahead and try again.
Okay, so in terms of activity or exercise, we wanted to point out some important characteristics. So what is when you exercise, you have to be sure you have the right intensity. And what intensity really means are kind of four main elements, right? Do you want to have the right frequency or the right number of sessions? How many per week? How many, and for how many weeks? You also want to have the right amount of effort. And by effort, we mean how strenuous is the activity that you're doing. You also want to have the right amount of time, or how long is each session. And the fourth is really the type of exercise that's performed. So what kind of exercise or what type of exercise are you most interested in doing? I want to show, I hope you can see that on the left-hand side of the screen is an effort, is a way that effort can be measured. And so the idea is really you ask someone when they're doing the exercise, how hard is this exercise now? Is it very easy to very strenuous or very, very strenuous? And this is a really simple way, but it's still like quite a bit the gold standard in many studies, a way to understand how much effort someone is producing or doing for each study.
Kathy, I'm sorry to interrupt you. It's only the title slide, so I think you have to move it forward.
Yeah, okay, so let me try one more time. I apologize. We had this down. Jen and I really did practice making sure it was share. I did. Let's try this again. I will try.
Technology.
Okay. Okay. Now, can you see the slides now?
Yes.
Okay. I'm gonna go. Okay. And can you see me going through them now?
Yep.
Okay. So now I'm on the intensity matters slide. Is that what everyone can see?
Yes.
Okay. So now, in addition to intensity, I wanted to share that, we know with AMN, the particular motor and sensory pathways that are affected. And we know this from pathology studies, but what it really helps us understand is why particular symptoms seem to come about, right? So we know that there's sensory loss more in the feet than in the hands. And we know that by sensory loss, the way we have really quantified that is by looking at vibratory sensation. And that gives us a little bit more information about balance. We also know that from our past studies that progressive weakness is a problem. It affects the legs more than the arms. And in addition to the primary loss of weakness because of the condition or the pathology, we also know that as it becomes more difficult to move, secondary disuse will cause even more weakness. And that's important, I think, because that's something that we can change right now. So that's where your daily activity or daily exercise can really combat that problem of secondary disuse. We also know that spasticity is a common problem, more in the legs than the arms. And spasticity is that kind of stiffness that you might feel in your arms and legs, legs more than arms. And that is really not voluntary. It's really something that is specific to the effects of the disease. We also know that walking is difficult, and we'll talk a little bit more about that. And we know that balance is an issue. Now, from one study that we did, it was a larger study with 142 men and women with AMN. We really asked the question, how important is strength relative to the other impairments that people with AMN experience? And what we found, and what I'm showing here is the paper, the title of the paper and the authors. So if you do have questions, this is available, or you can email Jen or I, and we can share this with you. And often people will say this is helpful to share with their physical therapist or their trainer, someone so that they can understand the importance of strength. and how strength might be affecting AMN. Now, within that study, we found that, oh, so now I can't see I can't see the whole slide. So within the study, we found that certain impairments were most important. When we looked at strength, for example, what we could see is that strength was significantly related to walking, to balance, to endurance, and to an exercise that we call sit to stand, which is just take some strength. Now, when we looked at the effect of sensation, so was sensation just as related to these four impairments? We found, yes, that sensation and strength were both very strongly related to walking, endurance, sit to stand, and balance, but not to the same extent. So strength was really much more, more strongly connected with these four activities. And when we looked at something like spasticity or range of motion, we found that all four elements were not equally related to activity. So this led us down this path of, okay, strength seems to be very important, more important in terms of understanding what activity you may be interested in doing. But understand that strength is not the only, as you may know, right? This makes sense. Strength is not the only impairment, the only important impairment. So one of the messages we really want to get across today is, depending on what it is your goal is, are you more interested in walking endurance, or are you more interested in improving your balance? That may lead you to what particular impairments you want to work on, whether it's strength and sensory changes, or is it looking at your range of motion as well as working on your strength? That combination might be really important for you to reach your goals. Now I'm going to leave it here for Jen. I think, Jen, you're going to take it from here.
Right. So we've been talking about the four main impairments: weakness, decreased in sensation, decreased range of motion, and spasticity. But each of these can contribute just to overall fatigue, because if it contributes to moving not as smoothly as normal or as quickly as normal, fatigue is going to be a big issue. And we typically treat fatigue with aerobic exercise, or just increased physical activity, building up your endurance to be able to participate in the activities that you want to day to day. And so there's two ways that we look at that. One is through your overall physical activity. So generally, how much do you move during the day, and can you move more during the day? I think everyone is wearing an activity watch these days where you can see how much activity you're getting. And we're finding that it might be important to see, are there times of the day when you tend to be moving less? And could you possibly add a chance to get up and walk around, on those hours when you tend to be sitting for longer periods? Or maybe you just slightly increase by, say, standing up from sitting 3 times. So say at the end of this webinar, you get up and you're going to be done, rather than just standing up once and taking off to the next room. You're going to do sit to stand 3 times before moving on. I'm sure you can think of other ideas of ways that you might increase your activity, but just generally increasing your physical activity is one way to work on your endurance. Another, I think, is what we more classically think of as aerobic exercise. So what are those things that you like to do? Ride a stationary bike, walk, run, maybe swim. Those activities, really, you can follow the American Heart Association guidelines. So you really want to get your target heart rate in order to while you're exercising. And the simplified way of doing that is to take 220 and subtract your age, and that's your heart rate max. And then you take a percentage of that, and that's where you want to work to get your heart rate up during this type of exercise. So I often say you want to start a little slow so you can avoid weekend warrior syndrome. I know it gets to, long end of the long day, and I just want to go out and I really want to run a 5K, but I really only run a mile, but I push myself hard and do 2 miles, then I really can't do anything the next day. So you want to build up slowly. So that's why you want maybe start at a little bit lower heart rate, target heart rate, and build up. You really want to work towards that 150 minutes per week. It can be broken down in any manner that you enjoy. this would also like to talk a little bit more about just how you might increase or track your physical activity. So there are trackers like the Fitbit or the Apple Watch, and there are other activity monitors out there that everyone is using. And then they pair often with an app like the iPhone Health app. And if we walk through this a little bit, you can see a way that you might use it to find times of day when you're less active. So you would look for the app with the heart on your phone. You can go to the selection of the activity, and then you can look and see what's your overall activity like for that week. So today I walked 3 miles, or for averaged over the week, how far did you go? But one key thing that's really important is you need to take that watch or that phone with you. Otherwise it just registers as, 23 steps, and it's hard to know what your real activity is. But you could take that accumulation of a week's worth of walking and see where your average is, 8,000 steps, and say you want to shoot for a goal of 10% more. So now you're going to try and somehow add another 800 steps to your day over the next month and try and increase that way. It's just one way to set a more reasonable goal and to get some real, online feedback. It's something that we can all do now while we're even in a different mode of moving around. You can see how much your activity has changed now that you're maybe not able to do the things that you were doing before. So for fatigue, again, we would recommend looking at your overall physical activity and then really establishing a strong cardiovascular program of some sort of aerobic exercise to help with endurance and to manage fatigue. So then we're going to move on to weakness. I think, Kathy, you're going to jump back.
So, right. So, and we'll talk about each of these impairments and try to provide some information from our work that will be helpful. So this is, I don't know, can you all see? This is going to be a mess. This was a slide where things would.
Do you want me to see if I can share mine?
Sure.
We could just try and change. Let's see. I think you just need to stop sharing and then I can.
Okay. Oh, well, there's, okay.
Just a sec. Oh. Okay.
There we go.
Is that working? Okay.
Yes.
Okay. Okay.
So, so we, one way that we have really looked at exercise is to do it, is to study it in the clinic or at home or in a gym. And so I wanted to share just a little bit of information. The video on the right here is from an article that we wrote in a video journal to try to better share the information about how you could do this. But what I want you to notice is that we're not using fancy equipment. We're just using therapy bands that you can buy online, you strap it to different parts of your leg, and you can do leg exercises with resistance training. And so in this way, you can really strengthen the leg at home and doing activities like this. Now, we did this in a gym, a Curves gym, but if you go one more step forward, Jen. What I want to talk about is the exercises that we had people doing with these resistance bands were something that you could do at home as well. It's just a progression of repetitions. So from the first few weeks, you would do 10 repetitions per set, and then you would slowly progress as tolerated to week 12, where you're doing 18 repetitions per set. And we had people do this 3 times a week for 12 weeks. The 12-week mark isn't really the golden important information. It's really that the frequency. You want to do it a few times a week, more than twice a week. And you want to increase your repetitions as you go. And just like I mentioned before, that the amount of effort you use is really easy to monitor if you just use a scale like this, that you can find this online or just write it out and keep track of how much effort you're using as you're going through your exercises. And this will allow you to know when it might be a good time to increase repetitions or increase weight. So I think there's one more if you click forward. Right, so again, so in addition to the amount of repetitions, you want to use resistance. Now, one form of resistance is just to use gravity. You lift your leg against gravity if you lie on your back, for example. Another way is to use resistance bands. The different colors mean a different amount of resistance. And the way you can make that one band more or less resistant is determined by the length of the band. So if it's really short, it's going to be much more resistance, and if it's longer, it's going to have less resistance. So that was our, and then I wanted to show, so what we did is we brought people in to train them on how to do this, this exercise program, and we provided the resistance bands, and we provided sort of directions like this. So this was just to look at hip flexion. So that muscle that allows you to go upstairs, for example. And what I want to show with this figure is really just that you can use these resistance bands to work on one particular muscle that might be the weakest muscle. What we found in AMN is that hip flexion is a really important part of that. Oh, right. So the other, if you can go back, sorry, I didn't finish that slide. So one way that you can modify this, if moving against gravity and with a resistance band is just too hard, is just to go over onto your side, and in side lying, just use a pillow so that your leg can, the top leg is supported, or a low bench, and then you just try to actively move your leg. And this way you're not having to move against gravity, and you also wouldn't have to use resistance bands. So again, there are ways that you can address the resistance by doing exercises without using heavier gym-like equipment. So the idea here was, for leg weakness, you could do what we call isolated muscle strengthening. I would suggest doing it with supervision at first, because you don't want to strain any muscles and you don't want to hurt yourself. We recommend doing 3 times a week for 12 weeks, but that's because that's how our study was designed. It may be that when someone helps to tailor the exercise for you, you might need more or less time to make the gains that you're looking for. But it really is important to keep track that you do different amount of, increasing repetitions and increasing resistance slowly, so that you can, as you gain strength. Okay, I think this is you again, right, Jen?
Yeah. Can you hear me? Okay.
Yep.
I muted myself. Okay. My dog might be making a little bit of noise in the background, so I apologize. Talking from home is sometimes complicated. So we'll move on to sensation. I think Kathy and I always talk about weakness because we know that that's so important. And I think using resistance bands, like she mentioned and we talked about, is really one way to bring the gym home to you, because if you don't have access to equipment at this point, or if it's not safe to exercise close to others, that's one way you might be able to consider modifying what you're doing. And we don't often talk about decreased sensation, but I wanted to touch on it a little bit because it offers some things that you might be able to do at home now. So if I can get it to advance. So decreased sensation, it can lead to imbalance and to incoordination. Our balance system, it really relies on sensation, but also on our vision and our vestibular system. So the vestibular system is your inner ear, and it tells you, whether or not you're positioned upright or rotated. And so when one of these systems is impaired, our brain tends to be pretty smart, and it upweights using the other means to help you balance, or you can train your system in order to use the things that you have accessible. So one thing that you can do if you have decreased sensation is turn on the lights at night, so you can rely better on your vision when you're walking and be less likely to lose your balance. Another is to use a walking aid like a cane. So rather than using it like a device that you put weight into, you're actually kind of extending the length of your arm to the floor to give you an idea of if you're shifting your weight from side to side more. That's a way in which an assistive device can be helpful to help you walk more safely. But then balance training is a really good way to optimize, what your body has available to you. And in one study that I was involved in, we did 4 to 6 days a week of balance exercises. And we saw an improvement in walking for people who did both sitting and standing exercises. But we can modify good core basic strength activity exercises to lying down as well. So there's a lot of options. But the one thing we found was that your exercise has to be challenging. And I think that takes us back to the effort. I know we often think about effort as in terms of like am I breathing hard, and do I feel tired? But when we're talking about it in terms of balance, we really want to talk about, are you putting something into the system that's making your brain have to figure out how to do something different or better? So for instance, if you used an exercise ball and you sit on it just while you're working and you're able to work and do things, it's just too easy. You're not challenging your balance in that way. If you sit on the exercise ball and you automatically fall over, or if you're sitting on it and you're holding on to something, the nearby desk or the wall, then you're not actually challenging your balance either. So it's all about finding the perfect fit. That would be too hard. What you want to do is, for instance, in this picture, there's a lot of different options. You might just raise your heel. You might just sit there. You might raise your leg with your knee bent. That would be less difficult than raising your leg with your leg out straight, because just the different ways that the forces and the weight of the leg shifts your balance off. Or you might be able to write your name in the air with your foot and manage to keep your balance. So it's all about finding it to be individual, just like with strength, that you address the muscles that are weak. You want to make sure that you find that you're challenging yourself appropriately when you're working on your balance. So if you have decreased sensation, which is very prevalent in AMN, these are the things we would talk about, turning on the light, considering using a cane, just to give you that added sensory input, and then taking up a balance training exercise program. It doesn't have to be long, 20 minutes a day. It could be broken up into 2 10-minute intervals, but it has to be challenging. And it could take as long as 6 weeks to see a change, so you need to stick with it. The next impairment that we wanted to address too was range of motion. I think we talk about that when we see people individually, but we don't always talk about it in a group. So I think that's just like, we always think about being flexible. Like right now, after you've been sitting here for a while, you might want to try a nice little side bend of your head. If you've been sitting for a long time like me and you tend to slouch more at the end of the day, if you get in your car, sometimes you have to readjust that rear view mirror because you're now shorter and you can't see out it the same way. It's just a sign. Laying on your back, stretching out your back, just can be a simple way to get a stretch. You shouldn't be bouncing. You should be holding a static stretch for 20 to 30 seconds. But a prevalent muscle that we talk about a lot, obviously, is the hip flexor. And not only can it be weak, but it can get tight from sitting more. And so it's important to stretch that as well. This is one of my favorite ways to stretch the hip flexor muscle. And then the ankle heel cord can also be very tight, and it can contribute to tightness in the bottom of the foot, which is something we call plantar fasciitis, maybe plantar fasciitis tightness. So stretching as well for that can be important. But in addition, and I don't know if we've talked about this before, but from the school of therapy that I came from, they actually don't really often suggest stretching. They actually suggest strengthening the opposite muscle group. Because if you make the opposite muscle stronger, you will actually lengthen the muscle that you want to lengthen. So for instance, in this figure, the person is actually stretching their hip flexors by doing a glute exercise, a donkey kick exercise. And I would say that this person actually has a tight hip flexor because they can't bring their knee all the way up to the same height as their hip, but they have good alignment. Everything's nice and straight. And over time, that she should feel a stretch in the front of her hip and be able to lengthen that muscle by strengthening her glutes. But you want to be really careful about form. So this gentleman, he's arching his back. This is one way that you can compensate for hip flexor tightness. So if the hip flexor can't give anymore, then the back arches. And so you're not actually stretching the muscle in the way that you wanted. Similarly, if you were to do the exercise, I think it looks like this gentleman is kind of turning his heel in towards the wall. That also will not be stretching the hip flexor in the way that you might be working to get strength in the glutes. And I think a lot of people, as people have different secondary complications of weakness, we tend to overuse our hamstrings. So to do this exercise with the leg out straight is actually a compensation for weak glutes, because your hamstrings can actually compensate for your weak glutes. So I think these are the things I just want to emphasize when you're trying to improve range of motion, that you make sure that you have good form for the particular muscle group that you're trying to change. Another thing that I think is important is using what's available to you equipment wise. So simple orthotics, like a custom orthotic is like a brace. It can be as simple as an insert for your shoe. If you stretch out your plantar fascia and it gets more comfortable, you want to maintain that good range of motion while you're doing your daily activities. So something as simple as a good orthotic in your shoe can work. Or if you're having trouble lifting your toes when you walk and you're tripping over your feet, there are some really cool carbon fiber, we call them ankle foot orthoses, braces that you can use to help clear your foot so that you don't trip while you're walking. And that just brings me to the summary. Sorry that the view's a little funny, but static stretching 30 seconds at least twice a day, and consider using the opposing muscle strengthening in order to lengthen the muscle. And then lastly, and sometimes one of the most difficult ones to talk about is spasticity, muscle tightness. So typically from a rehab perspective, the main thing that works best for spasticity is prolonged stretching. And that's definitely more than the 2 repetitions of 30 seconds when you're trying to increase your range of motion. It's more like a boot that you can wear all overnight or all day, or a cast that you might wear, because you need to lengthen that muscle and get it to relax more significantly. And so in something like this, we would want people to obtain the right equipment, because it can be very difficult to make sure that you have something that will position you well, and also make sure that it counts for having good skin integrity. It's easy to have problems with your skin when you're in a brace or a cast all day. But if you try bracing, we're talking more like 4 to 8 hour intervals. And casting can go for 1 to 6 weeks, and they change the cast weekly. It can be very effective, but both means you need to have some rehab afterwards to not only maintain that length, but also to increase your strength as well. And so in summary, we really think that exercise is medicine, and these are hopefully some things that you can take home to start doing tonight or this week, or maybe just to your local PT who maybe doesn't know as much about AMN, and get some ideas that you can do at home. I know we're doing everything on Zoom, most of all our physical therapy. So if you can find a local PT who's allowing for telemedicine, that's one way to get started on a good home program. And it's been great to be able to see how to make modifications for people in their own environment. And then you also want to clue into those impairments that are affecting what it is you want to do the most, so that you can address them and individualize your program so that you're addressing your weaknesses. We always push more strengthening, so get out your resistance bands and get moving. And we'll help you get started today. We want to thank all of the patients and participants who have come to the Kennedy Krieger Institute or our motion analysis lab. We really thank you for having us tonight to talk with you, and we're looking forward to some discussion.
Great. Thank you, Jen and Kathy. This has been wonderful. I have to tell you, there's so much. It was packed with, and I'm glad it's recorded because we go back, but maybe we can open it up for questions that people have. You could either type your questions in the Q&A, or you could unmute yourself, or maybe Emma can unmute them since she's the host. So anybody, if you have a question, you could raise your hand just by the top right corner. There's 3 dots. You raise your hand, or you could ask a question by typing it in.
Nikki had a question. She raised her hand. So Nikki, do you want to say your question? Or you can type it in the chat box if you don't want to say it out loud either.
I think you're muted too, Nikki.
There was a question that came in, was typed in. Is there anything different that women with ALD should do? I am curious about that.
So one of the things that that we've noticed from our studies of, with women with AMN is that there's more issues often with pain. And so it would be something, we don't have great solutions, I will say that, but I think it's important to be aware of that and to offer that information to your rehab specialist. Be very clear of where you have the pain and when you have it, and see if there are any, it might be that some of the pain is related to muscle shortening, but it probably is very individual. It's just something that we noticed and we know needs to be studied more. I don't know, Jen, do you have other suggestions?
Yeah, so I also, someone wrote if they can get a copy of our curves article. We have it out. We're hoping that it comes out soon. But right now, I would say, right, that pain has been more prevalent in women that we've noticed, but at the same time, it would actually change with exercise after participating in the curves exercise study. So I think that it's an important thing if you can exercise. I would also say that we noticed from the big, large first study that sensations seem to be a little bit milder in women, but it may be affecting your balance earlier compared to men. And so it might be something worth working on balance early as well. And then the last thing that we noticed was that in the curves exercise studies that, you know, there's a lot of women that were in the more like 40 to 60 year range. And compared to their age matched controls, their hip extensors, that donkey kit exercise, it started off weaker than the healthy age matched controls, but it actually got up pretty close to equal. So I think that one thing's just important to note is that we can get weaker as we get older, just as a aging factor and just maybe also as becoming less active. And so you might be able to make changes that are more age related than AMN related. And so to keep that in mind, I think is important.
And if we can share the strength paper, I'm happy to share with Emma or you can email either Jen or I and we can share that with you. And as the curves, you know, once the curves article comes out officially, then we're able to share that.
Yeah, we can definitely post that on our social media pages and on the website as well if you want to share that, Kathy.
Okay.
Okay, there's a couple other questions that came out. Are there exercises for leg spasticity? Or is mainly the stretch that you referenced, the brace?
Right. So some like prolonged stretching is going to be the most effective thing for spasticity. So if you can have some sort of bracing that you can use overnight to relax your spasticity, that's one thing. And then but then you can also it works well in conjunction with your physiatrist to do, there are some medications that can also address it, but I think it's good to always to do it in tandem so it's not done on its own.
Okay. And then there's another question. I'm a 68-year-old ambulatory and active AMN woman. My podiatrist gave me a night brace to wear 1 hour a day versus the PT at Mass General said that won't help. Do you have an opinion on the night brace?
Well, so I'll just say one quickly because Jen, I think you probably have more to say about this. I mean, I think it would be important to try wearing the brace and seeing, you know, it's something you can do right now and see, you can keep track too if it makes any changes. And so sort of to make the decision for yourself too, how does it feel?
Yeah, I think, I guess it's hard to give specific advice. I'm afraid, especially not seeing somebody, but I think that there's, you know, I mean, I guess it would be good to get all those parties involved and why someone says it won't work. I mean, I guess it'd be good. I'd like to know if you've done it for 1 hour a night and if you've noticed if it's changed at all or not. It might be because if they gave you a non-custom brace, one that they can just order off the shelf, that they haven't casted to fit to you, it can allow for different movement, especially at night when you're not aware of what's going on. And so if you're not being positioned appropriately during even that 1 hour of time or more, you're not going to get the stretch that you need. So so I usually recommend an orthotist or prosthetist rather than a podiatrist. There are people that you think of that provide like prosthetic limbs, but they actually provide a lot of, they're like artists or sculptures. They make a cast of your leg and make a brace from that can be a lot more effective. So I might consider adding to your number of people that have weighed in and see if they might be able to offer something more appropriate.
Right. I think also having a tailored brace made for you would avoid, sometimes people feel like it's so uncomfortable to wear at night. And you get some sores on your leg. So having something that fits well is probably very important. You know, what goes along with poor sensation is that you might not notice that you have areas of rubbing or where you're maybe acquiring some small sores. So be very careful and make sure you look at your leg each day to keep track of that, because you might not feel it.
And then Catherine had raised her hand. Catherine, do you want to ask your question?
Yes, well, it's not so much the question. I actually just wanted to provide a bit of an exciting update. I have a long history. I've participated in the Curves program, and I've always been very active. I would say as a female, I'm very low on the pain scale, but pretty high on the gait disturbance issues. And I'm approaching 50 very quickly next week, actually. And I feel like in the last couple of years, it's been sort of the impact of all the compensatory behaviors that I guess my brain has adapted to with the weaknesses that I have that have really caused significant problems with dorsiflexion and toe drag and weakness. But recently, actually coinciding with the pandemic, I started a new PT program that has really been very exciting. I'm working with a PT who, well, with an agency or a company that has a lot of experience in working with stroke victims. So it's a lot of gait retraining, but then they also have an emphasis with Postural Restoration Institute, PRI. Again, I'm not very familiar with that, but just it's that combination of a lot of pelvic focus, you know, so making sure the pelvis is very stable, and then a lot of single leg standing and balance work, and then just that gait retraining has really been phenomenal. I mean, it's been very exciting, and I've noticed some regaining of strength and capacity in the last month or two. That's been pretty exciting. So I just wanted to report that and to say that sometimes I think the weakness masks some of the strength that is still there. And so it's been great to work on those and to increase that ability. Thank you.
That's great.
Thank you, Catherine.
To quickly add to what you just said, something that I've learned in the last 6 months through Pilates is that glute exercises and strengthening of your glutes works in contingency with pelvic and hip. That synergy that occurs between that, and by strengthening your glutes, you are able to really help to improve balance and stability.
You know, you both are really great examples of how important it is to tailor your exercise to your particular issues, right? And so and you can do this through a group class, or you can do this if you're really aware of things, or you can, if you find the right person to work with that is really very careful and looking at how you move and the form that you use when you exercise. You know, I think those are really key elements to a good exercise program.
I have a question. Is there a way to access some of these exercises on a website? Do you have a website at Kennedy Krieger, or is there something we could post? Because some of those exercises you shared on the variance balance, and it was just terrific. So
the webinar is actually being recorded right now, and it will be posted on the ALD Connect website. So that will be there.
Great.
We also have another question in the Q&A for Kathy and Jen. If you've been using a wheelchair, is it possible to make a comeback?
Well, it's definitely, you know, I think the fact that you're using a wheelchair doesn't necessarily mean that you're optimizing all the strength that you have, right? So it would be important to have someone really evaluate what muscles are weak and see if you can make some gains. There are other tools that we have not talked about, such as electrical stimulation, that might be of some help too. Jen, I'll let you jump into if there are other things you can think of. I definitely think it's worth a try. You know, the fact that you've lost some strength can be a secondary disuse problem separate from the condition itself.
Great. So I guess I think some things are not our basic strength training program probably applies, which I think is always sort of a hard thing to like, you figure out how you're supposed to modify that to meet what you're doing. And I think I've kind of become interested in, there's like something called original strength that a guy has been marketing to the general population for exercise, but it involves basically doing our normal functional activities in a repeated manner and getting stronger in that way. So he actually really emphasizes things like, I've used it in our exercise study for people with multiple sclerosis, actually, as a functional exercise. Just try rolling from your back to your side and then coming up to sitting in your bed, and then lay back to your side, roll back onto your back, and then do that. Try doing that for 5 minutes to one side and then switch and do it 5 minutes to the other side. You will find that you have to use a lot of your trunk muscles. And if you try and do it in like a different format than you usually do, I think that you'll find that you have to use, you know, different muscles that you haven't used in a while. I think also, you know, it's important to spend time in different positions than you are. So if you spend a lot of time in a wheelchair, I think it's important to see if you can spend time, you know, laying on your stomach. It's sometimes the way that we don't usually stretch out in the same manner. And then I think in order to target those muscles, we tried in our MS study to take people who had all different levels of strength. And so, you know, you may have to modify them not just to laying on your side, but maybe with some level of assistance at the beginning. And then, as Kathy mentioned, there's a lot of high-tech options out there, functional electrical stimulation. If you want to pursue something like that, that's usually at an academic center would be the place to go, probably someplace where they treat either MS or people with spinal cord injury. They would have access to that kind of equipment as well.
And then Matthew had a question. Matthew?
If you're muted, Matthew, that's always my mistake when I start.
You can also type questions in the chat box too. And if you have questions for Patrick or Tim about their daily routines, I think that they'll talk quickly about what they do. I know Patrick talked about Pilates.
I'm actually reading Matthew's question.
Oh, perfect. Sorry, just saw it.
He referenced an ankle injury, which I'm very familiar with ankle injuries. They're nagging injuries that will plague you for a very long time. Part of my goals with exercise is to prevent future injuries, but pertaining to dealing with it on a daily basis. For one, I have orthotics that I had made that I can't wear shoes without because my feet just start throbbing. Secondly, I actually learned that ankle braces put too much pressure on my feet and my toes actually start to go numb. So what I've found is that good wool socks, and y'all are gonna laugh because I told y'all that I live in Houston, Texas, where it's muggy right now. I wear wool socks every day of the year, and they provide excellent support. It really helps to keep my feet from swelling during the day, and it just offers more support. But overall, ankle injuries are the worst thing that we can deal with, and the more support that you can give to them and the more aware you are of your surroundings, and that goes to the whole walking aid, you have to really ask yourself, you know, should I be using one? Because if you find yourself constantly falling, then you're going to have lots of issues with that down the road. And that's why it's just so important to, you know, have a realistic perspective when you look at what your capabilities are.
Yeah, I would just add, I got these orthotic braces made for me, and it's helped me with the lift more than anything. But the secondary piece is it does give me greater support for my ankles. So it's worth, it certainly has helped from a mobility standpoint. I could walk further as a result of that. So I think you gave that tip earlier.
I think you guys make good points about that. I think your point about the wool socks, I was going to say the other thing is just even travel socks, the compression socks that people wear when they're traveling or after sporting activities, you know, to help with recovery. They can provide the same kind of thing to help with it helps with blood circulation basically. And so by doing that, we just think that it helps with better blood flow to the area, which may help somehow maximize the sensation that you have in your feet. But then also preventing the swelling, which that can make things more uncomfortable. I don't think that that's the thing that will that can help contribute probably to the ankle injuries. I think it's probably important to not just go to like an orthopedic physical therapist, but possibly to go to a physical therapist that treats people like Catherine was saying about, you know, like a stroke or a MS, because sometimes there are other things like maybe typical electrical stimulation may not work, but there might be other means that you may be able to use to strengthen your ankle at this point. And so it's important to investigate more areas, I guess.
Yeah, we had a slide like that we took out. And so so stroke clinics are really good. Also spinal cord centers might offer some information for you.
Well, great. I just want to say a big thank you to Jen and Kathy as well as Patrick for joining us. This has been extraordinarily helpful. I know for the ALD community, both men and women need to get this. So thank you for making a difference in our lives. Thank you for what you do every day. And we're at the top of the hour. So I'm going to, at this point, sign off unless, Emma, there's anything else you want to announce.
No, that was it. There was just one other question about exercises for restless leg.
I don't have an answer for that one.
You know, restless legs, I think it's a complicated problem that I don't think we have very good solutions for. So, you know, I would try stretching, and I would, I think that's probably the only thing I can think of that I would suggest. I don't know, Jen, do you have other, or Tam?
I think aerobic exercise as well, just anything that would give you just generally, I don't know for sure, like the best solution. It might be one of those things too that you use your fitness tracker and see if it makes any difference. If you have one day where you have more activity and it's like from a fatigue perspective, or if it's a day that you did more activity, it's a little bit better. It can all just help contribute to what plan you use. Sorry, nothing better than that.
I will say I try to stretch every night, and it's a big help. And just taking 10 minutes, and I've been using this thermo gun, which is like a massage gun that on my legs, and I tend to sleep a little bit better. I don't know if it has anything to do, but it makes me feel better. So, well, thank you again. Thank you all for joining us, and have a great day. Appreciate you guys.
Thanks for having us.
Take care.
Thank you.
Bye.
Okay.